Welcome back to this channel where we talk about the basic medical information making a difference. Those ones who have just come across this channel for the first time, consider to subscribe because subscription is free. The returning subscribers, thank you so much for always coming back to check on this channel. I go by the name Rebecca Morangi, and this is the best place to be. Kindly watch the video till the end. What are the risk factors of this condition? If you get to know the risk factors, you can be able to prevent these infections from occurring. The risk factors is what exposes you to this condition. One of the risk factors, these infections are caused by bacteria. And if they are caused by bacteria, so the bacteria can enter the urinary tract system through sexual activities or poor hygiene. The major bacteria which causes this infection, one is what we call E. coli, which is found in the digestive system, and also what we call Staphylococcus saprophyticus, which is found in the genital area. The risk factor here is that if somebody uses the bathroom and wipes herself or himself the wrong way, and especially women, because the urethra in women is shorter, the bacteria can be transferred to the genital area, which will go through the urethra and enter to the bladder and gets to multiply. Those people who are sexually active are at risk of getting this infection because the bacteria is pushed up through the urethra to the bladder through sexual activity. And these risk factors can be prevented. We are going to look on how one can prevent these infections. Another risk factor, it's raining heavily outside, but you can get me. Another risk factor is what we call a weakened immune system. Some people have got conditions which weaken their immune system, which leaves somebody vulnerable or expose someone to these urinary tract infections. An example of those people who are diabetic, those ones who have a condition we call HIV, and even cancer. Another risk factor is what we call using some certain type of birth control methods. And here, this one mostly affects women because of the hormonal changes, which causes the infection in the body, even the bladder. We have those who use what we call diaphragm, or those who use a birth control method which contains spermicides. Pregnancy is another risk factor because of the hormonal changes, which will increase the risk of the bladder infections. And this is mostly in women. Either you have a discharge or you have this pain during urination, so you cannot miss something. That is why you're advised sometimes to take a lot of water. So you flush out these infections or these bacteria from the body. We are going to see more on the prevention part. Menopause is one of the risk factors because of the hormonal changes. Long-term use of catheters. Some people are under the use of catheters because of their health conditions. So this can expose somebody to these infections. And also interfering with the flow of urine can expose somebody to these infections. And how? Actually, those people who have a condition what we call an enlarged prostate, especially men. So when you interfere with the flow of urine, urine is supposed to move smoothly. So if somebody has got an enlarged prostate, and from the structure here, the prostate is somewhere here. Here are the urethra, this part down here. So if the prostate enlarges in size, it gets to squeeze this part, the urethra, and the flow of urine is interfered with. So you will find that sometimes urine is retained in the bladder because there is no smooth flow of urine. So an enlarged prostate can interfere, which will expose someone to this condition. And also another condition, it can expose somebody to, or can make somebody to interfere with the flow of urine, is what we call kidney stones. We mentioned that if you get to know the risk factors of this condition, can prevent this from happening. If there are those you can prevent, especially the point of hygiene and what you call sexual activity. We have other urinary tract infections, an example of chlamydia and gonorrhea. These are what we call sexually transmitted infections. These infections can cause urethritis because the infection can spread when you get into contact with an infected person. And these bacteria can enter to somebody's urinary tract system through sexual activity. Up to this point, I believe you have understood clearly how you can prevent this from occurring. Kindly keep on getting this information because information is power. We shall meet in the next section where we will get to know how these infections can be diagnosed. Let's meet in the next video, and bye bye.